And welcome back. Medical Monday once again. Sports-related injuries are somewhat common for those who live an active lifestyle. But of course, we're going to be talking about that right now. The good news is they're treatable and also preventable. East Cooper Medical Center is ABC News 4 hospital expert, and Tom Moriarty joins us this morning to talk about sports-related injuries and also prevention. Welcome.
Thanks.
Thank you.
Thanks
I think this is very interesting because not only adults but also kids. Let's describe what's the definition of a recreational athlete.
Probably the general definition is any non-pro athlete, but I think we can go a little bit further. Kids get into sports with our local recreational departments, and they want to do it to get exposed to it and enjoy it. So. Children who participate in the local recreational sports programs, and then adults once we get through high school and college and we want to do things to enjoy sports, softball teams,
stay active,
recreational athletes as well.
Now, how can you prevent sports-related injuries?
You know, the basic and first thing is to be conditioned for the sports you want to take place in. So general conditioning, to have the flexibility, the strength, and the cardiovascular fitness to participate in whatever sports you want. And then you may get a little more specific. If you're playing tennis or volleyball, you might have to look at your shoulder, rotator cuff musculature, to make sure there's no deficit there as you use your arm in an overhead position.
Okay, now let's talk about, you know, when you're doing these recreational sports, and especially if you're a little bit older, you're an adult, and, you know, as we age, we get little aches and pains that may not have existed before.
That's
but and let's talk about when you have those little nagging aches and pains, how to differentiate whether or not it's something that could potentially stop us from doing, you know, enjoying the sport that we want to.
Yeah, so we, you know, we try to teach what is good or normal pain or normal soreness after participating in an event versus pain that might shut us down or put us out of the activity we want to enjoy longer. If you're limping or you can't move your arm and do things you normally like to do, it's probably just a little too much.
Absolutely. And then you would let us know, you know, how much rest we should or how many days we should take off in between. Like maybe you might only want to play tennis 2 days a week versus 4 days a week or something like that to help it to adjust.
Modifying the activity levels, you've described it perfectly.
Now, as a physical therapist, how do you help an athlete?
Yep, what we do is we can look at, if you have an ache or a pain, we can look at it and try to determine the cause or the source, so if there's any imbalance there, and we can address that. We can also address overall conditioning needs, like if a muscle's tight or weak, we can address that specifically. And then we look at a person's overall structure. Are there any structural deficits? You mentioned as we age, and as we age, we get a little imbalance. And a good physical therapist can take a look at a person and see where those imbalances are and tell you how to address them.
Now, how would you know that seeing a sports medicine physician is the best way to go versus just your normal run-of-the-mill general practitioner?
That's a really good question, and I think that if you are very, very active and you're active in a sport and you develop pain and you know it's related to that sport, that is a good time to seek out a sports medicine orthopedic doctor.
All right, now let's talk about this big event that you have coming up, and it's going to be at the East Cooper Medical Center, and it's happening in March?
March 15th, Saturday, 9 to 12, Shoot for Good Health, and we are going to feature a lecture on conditioning for the recreational athlete. We'll have free health screenings. Our sports medicine director, Dr. David Geyer, will be there, as well as our sports medicine team of physical therapists. You can come talk to us in person.
All right, well, it sounds like fun, especially all of you recreational athletes. Take yourself seriously, take what you do seriously, and most importantly, take your health seriously when it comes to enjoying that favorite sport that you like. Thank you so much, Tom.
Thanks for having me, Tess.
All righty, well, remember, you can find more information on this topic and learn more about East Cooper Medical Center. Just visit our experts page at abcnews4.com/experts. Stay with us. We're back after the break.